So now I'm going to read a little bit of this AP article that's fact-checking this claim that now AIDS are on the rise in Israel, which their population's like 100% vaccinated. So there was this like rumor or claim going around. I heard it a couple of times actually. Some people after getting their first or second dose, it was fairly early on before the boosters started. But they were saying that if you got vaccinated and then you went and got an HIV test, you would test positive. And they didn't say that the rumor was false. You would test positive, but they said it was just something in the vaccine that like made it a false positive. So this AP article fact checks those claims. So they say that it's false. COVID-19 vaccines do not cause AIDS, and public health experts say cases of the virus that causes AIDS, HIV, have not dramatically risen in Israel following mass vaccination. So it says in a video clip circulating widely on social media over the last week, a doctor who has promoted hydroxychloroquine as a treatment for the COVID-19 suggested that half of Israel's population now has AIDS from receiving multiple vaccine injections. A physician from New York made the comments on March 23rd during an interview with a conservative blog, in which he also asserted that multiple injections of COVID-19 vaccines destroy people's immune systems. But the claims are incorrect, according to several media experts interviewed by the Associated Press. An Israeli epidemiologist who advises the country's government on COVID-19, as well as the Israeli Medical Association on HIV, said Israel hasn't seen a rise in its HIV rate since the pandemic began. As the AP previously reported, claims that the COVID-19 vaccines damage the immune system are false. Research from the CDC and others show the vaccines boost the immune response. The claim is that they have AIDS, and they debunk it by saying that medical professionals are saying that nobody has HIV. It's like, okay, well, do they have AIDS though? Because HIV and AIDS are two different things. What theoretically the pharmaceutical companies could be doing is destroying people's immune systems by basically, now you're getting all these boosters, so it's your immune system is artificially working. And if they last about 3 months, so if you keep going to get it, then now you need these boosters in order to have any kind of immune response at all. And that's what AIDS is you don't have an immune system basically anymore, so you just can't fight off a lot of diseases and illnesses. So if your immune system's not working on its own, for all like intents and purposes, like you do have AIDS. If you are a slave to big pharma for the rest of your entire life, because if you don't go get your booster every 3 months, then your immune system's not going to work, and the common cold could kill you, and you basically have AIDS. So could be that. And if everybody that's taken it now basically has AIDS and their immune system doesn't work without it, then they can't really decide, once they're already in your little web, they can't decide that they just don't want to spend money on this anymore, that their immune system's not going to work without it. So they're stuck. And coincidentally, right around the time that the government's not going to be paying for this anymore, and it's around like your 5th dose, 3rd booster, whatever, the pharmaceutical companies are now going to hike the price of the vaccine. So it will now be about $110 to $130 per dose, according to a Pfizer executive. So right when people have had enough of these boosters to make their immune systems reliant upon needing the shots, now everybody's stuck and they can jack the prices to whatever they want. Sweet.